Hello and welcome to Smart Lawyers Love Dumb Nurses. I'm Brian Smith, and today we're diving into a topic that's painful, urgent, and far too common. The rising tide of abuse against nurses and healthcare workers. Let me start with a number that should stop you in your tracks. 81.6% of nurses report experiencing at least one type of workplace violence in the past year. That's not a statistic, it's a warning siren. According to a 2025 report from World Metrics, 80% of healthcare workers, including nurses, have faced workplace violence. Nearly 75% have endured verbal abuse, and 25% have been physically assaulted at least once. On average, 57 nurses are assaulted every single day in the U.S. That's 2 nurses every hour. These attacks happened in emergency departments, psychiatric units, pediatric burn centers, and even rehab facilities. The perpetrators, patients, yes, but also family members, visitors, and sometimes even co-workers. And most attackers are men. Let me be clear. Verbal abuse is abuse. Being screamed at, threatened, demeaned, or harassed is not part of the job. Don't harm me while I'm trying to care for you isn't a plea. It's a truth that every nurse should be able to speak without fear. So why is this happening? Number 1, stress and frustration. Patients and families are overwhelmed, scared, and sometimes grieving. That emotional overload can explode into violence. The COVID-19 crisis, it shattered trust and left healthcare workers exposed physically and emotionally. Understaffing. When nurses are stretched thin, wait times grow, needs go unmet, and tempers flare. Misinformation and distrust. Some people no longer believe in the system, and nurses become the target of that disillusionment. But we're not helpless. Here are strategies to combat this epidemic. Report every incident, even verbal threats. Violence only protects the abuser. Man saves staffing. Only 29.5% of nurses say their employer has staff available at all times to respond to violence. Use de-escalation techniques. Training matters. So does backup. Create a culture of zero tolerance. Abuse should never be normalized. Lean on each other. Peer support, counseling, and shared vigilance can save lives. And here's where I introduce a concept I call healthy paranoia. It's not fear, it's awareness. It's scanning the room, reading the energy, knowing when a situation is about to turn. It's trusting your gut when it says step back. It's knowing that your safety matters just as much as your compassion. Some truths are hard to swallow, but they must be said. I'm here to heal, not to be hurt. You don't get to hit me because you're scared. Respect is not optional, it's essential. We must teach this to our students, remind our colleagues, and demand it from our institutions. Because in the court of public opinion, there are seldom more tragic verses. Smart lawyers become rich on the deeds of dumb nurses. Thank you for joining me today to discuss this important topic. My name is Dr. Brian Smith. Stay focused, stay prepared, stay kind, and stay tuned. Thank you for listening.